The other common disorder which we normally see because of the our lifestyle today, we are now used to more of a sedentary lifestyle, and because of COVID, when there was a lot of work from home, so the lifestyles have become more sedentary, and we have become averse to exercises. So the end result of all this lifestyle modification is a metabolic syndrome. Metabolic syndrome comprises of obesity, diabetes, hypertension, and dyslipidemias. And the most important of all them is a sleep apnea syndrome, which is called obstructive sleep apnea syndrome. Now, what happens in obstructive sleep apnea is that because of the increase in the diameter of our neck and because of the overall obesity, so our airways tend to narrow down even when we are awake. So normally when you sleep, the airways narrow down because whole of the body tends to relax. But because of the already narrowed airways, due to obesity, the airways collapse when you sleep. So that causes, when the airways, ends of the airways, touch each other during movement of air in sleep, that causes snoring. And at time occurs when it totally collapses and the airways shut. So the air doesn't go inside, or the inside air carbon dioxide doesn't come out. So that causes a decrease in oxygen levels in the blood, and that low oxygen level arouses your brain to wake you up, otherwise the person will die. Now because of that, what happens that you wake up and that's a protective reflex, but you are angering the brain. The brain wakes up just out of nothing. So it tends to secrete some hormones, like the growth hormone, like the steroids, corticosteroids, like the insulins and all, glucagon, insulins and all. So that they tend to change the body metabolism. So what the end result is that these hormones then lead to high blood pressure, they lead to high sugar levels, they lead to altered lipids in the body, causing all these components of metabolic syndrome, and the end result is heart disease and the brain disease. So in the heart it causes myocardial infarction, which is a heart attack, and in the brain it can cause stroke. So this is a typical pathophysiology of sleep disorders because of the sedentary lifestyle. And this obstructive sleep apnea is just 20 to 25-year-old disease because of our change in our lifestyles. So the treatment for it is, the cure for it is your lifestyle modification, which includes regular exercises, loss of weight. But it takes long time to achieve that. And if we continue to wait for our weight to reduce and the sleep apnea to go, so we might become victims of whatever the effects I told you. So what we do in that during that period is we do a sleep study, and try to find out the level of apneas, what we get, the number of apneas in an hour. So on the basis of that, it is classified into mild, moderate, and severe obstructive sleep apnea. And also the sleep study also tends to find out how low the oxygenation goes in the body. So depending on that, so we do another study trying to give a machine, which is a CPAP, which is a continuous positive pressure machine, which tries to keep your airways open so that all those things don't happen and you get a good night's sleep, as well as all those side effects get averted. So that machine, once we give the pressures and all those things, that machine is to be used every night in the home, and the sleep studies we do in home, and to find out whether the patient has a disorder, and if the patient has a disorder, this obstructive sleep apnea syndrome, and what is the level of the machine, what is the level of the pressure we have to use to get over that obstruction.